Hi, my name is Dr. Mahmood Nadim. In this video, I will discuss about the benign prostatic hyperplasia and we will discuss about the ultrasonography for investigation or diagnosis of prostate disease or prostate enlargement. There are two types of ultrasound can be done. One is suprapubic per abdominal ultrasound and second is transrectal ultrasound. First type of ultrasound that is done through the lower part of the abdomen or the pelvic area, that is suprapubic per abdominal ultrasound. This is first type of ultrasound and that is also commonly done. In this first type of ultrasound, we use abdominal wall and a urinary bladder and go deep to the prostatic body and check the size, volume and all the details of the prostate. When we are doing this type of ultrasound, there is a great distance between abdominal wall and deep to the prostatic body. In between there is a urinary bladder, so there is a large distance more than 10 centimeter. So during scanning, it's not easy to see the prostate in details during imaging time. Though it's a real-time imaging, but it's very difficult to check each and everything inside the prostate because the distance between ultrasound probe or camera and prostate, there is a urinary bladder intervening in between. The second type of ultrasound, that is a transrectal ultrasound, and this type of ultrasound is very important because in this case we use a probe that's just like a pen or pencil type probe, and we insert into the anal canal or rectal area and just touch the prostatic body, because between the probe and the prostatic body there is just only a rectal wall intervening between the two structures, probe and prostate. So in this type of imaging, it's an amazing type of ultrasonography, and because the probe is also a high resolution probe, more than 8 megahertz, and this frequency is much better than first type of ultrasound we are doing through the abdominal wall. During transrectal ultrasound, we see a prostate in a very clear imaging, and the prostatic body, the capsule of the prostate and seminal vesicle, and of course a rectal wall and the anal canal and also the urinary bladder. So all of these structure we can detect or see any type of pathology over there. Another importance of transrectal ultrasonography is that this is the same procedure or scanning through which we also take a biopsy. Of course, that is with the help of this transrectal procedure, and ultrasound guided biopsy is taken most of the time. If you watch this video, you can see there is a lot of structure inside the prostate. You can say there are a lot of areas in the prostate. So prostate body and prostate zones are very much clear through this procedure. During transrectal ultrasonography, we can see all the zones of the prostate or all the parts of the prostate, because all these zones of prostate, they play a very important role in the pathology of the prostate. Suppose the outer region, that is called peripheral zone, all the carcinomas or the cancer or malignant tumors, those arise from this area. So through transrectal ultrasound, we can see and detect these tumors, whether these are benign tumors or a malignant tumor, whether there is some type of cyst inside prostate, or there's some calcification or any type of abnormality can be detected and seen in a real time during the scanning of transrectal procedure. So there is another advantage of transrectal ultrasonography, that there is a color Doppler imaging system in the machine. With color Doppler imaging scanning, we can differentiate between a malignant tumor or an innocent tumor, a cyst or some solid mass. So this type of color Doppler phenomena in the machine, that is very helpful to differentiate types of all the masses or the tumor or the some other pathologies. Even color Doppler phenomena is very important to detect the inflammation in the prostate or some type of infection like a prostatitis. So it is very important to remember that if we compare the first type of ultrasound, that's parabdominal suprapubic type, we have no such type of advantages like I already explained before. Most of the doctors, they advise transrectal ultrasonography just to see the details of the prostate and prostate size, prostate volume, prostate weight, everything.